Today we are going to talk about different transfusion reactions. It is a very important topic to understand when you are working as a healthcare professional, whether as a doctor or as a paramedical staff. So let's talk about it. Transfusion reaction can vary from mild to very severe and life-threatening reactions. The one factor which is most important while dealing with the transfusion reaction is the time at which a specific reaction takes place. So we will discuss different transfusion reactions according to the time at which they take place after the transfusion. The first in this list is the anaphylactic reaction. This reaction takes place within seconds of transfusing blood, and the patient presents with hypotension, wheezing, and angioedema. And what is the reason for this reaction? The reason behind being the blood of the recipient is mainly deficient in IgA, and this leads to this reaction. The second one is acute hemolytic reaction. This reaction takes place within 24 hours of transfusing blood. And the reason behind this reaction or the mechanism is ABO incompatibility. And the patient presents with pain in the flank region, fever, hemoglobinuria, and the severe cases may progress to DIC or disseminated intravascular coagulation. What does this ABO incompatibility means? This means that if a patient whose blood group is B positive receives blood from a person whose group is A positive, the immunoglobulins present in the recipient's blood will attack the red blood cells of the donor's blood, and this will lead to hemolysis of red blood cells and acute hemolytic reaction. The third one is febrile non-hemolytic reaction. This takes place within 1 to 6 hours of transfusing blood. And what is the mechanism behind this reaction? Actually, this febrile non-hemolytic reaction is the most common reaction. The main reason behind being that the white blood cells in stored blood, these cells produce different cytokines, and when this blood is transfused they trigger the immune response in the recipient, and this leads to the febrile non-hemolytic reaction, and the patient mainly presents with fever, headache, and chills. Fourth one is urticaria. This is an allergic reaction, and IgE immunoglobulins plays main role in this reaction. This reaction takes place within 2 to 3 hours of transfusing the blood. The next one is trolley or transfusion related acute lung injury. What is the mechanism for this injury? The donor's blood contains anti-leukocyte antibodies, and these anti-leukocyte antibodies attack lung tissue of the recipient, causing acute lung injury, and the patient presents with respiratory distress and pulmonary edema. So if your patient which is undergoing blood transfusion presents with respiratory distress and pulmonary edema, don't forget to include trolley in your differentials. The next one related thing is the TACO. TACO or transfusion associated circulatory overload. This occurs if the rate of transfusion is too high or the quantity of transfused blood is too high, that the patient's body cannot handle the transfused blood and the fluid backs up in the lung tissue. This again leads to pulmonary edema. In actual, the hemolytic reaction can occur after days or weeks after the transfusion, and these transfusion or these hemolytic reactions are known as delayed hemolytic reactions. These occur after days or weeks after the transfusion. These reactions take place due to the formation of amnestic antibodies and amnestic antibodies, and these antibodies are formed in response to minor antigens present on the surface of red blood cells. Minor antigens. The last one is the graft versus host disease. The graft versus host disease takes place when the immune cells in the donor's blood attack on the cells of the recipient. The most commonly attacked cells are the ones that make up bones, different skin cells, different cells in the GIT. And this leads to the symptoms of pancytopenia, rashes, different GI symptoms. This reaction mainly occurs in the immunocompromised patients where the immune system of the recipient cannot deal with the immune cells of the donor's blood and leads to graft versus host disease. This reaction is very rare, but it is almost always fatal, and it takes place after weeks of transfusion. So let me revise it briefly for you. The main important thing in transfusion reaction is the time at which a reaction takes place. The first one is the anaphylactic reaction, which takes place within seconds of transfusing the blood. The symptoms are hypotension, wheezing, and angioedema. The reason is reduced IgA level in the recipient's blood. The second is acute hemolytic reaction, which occurs within the 24 hours of transfusing the blood. The main reason is ABO incompatibility, and it presents as pain in the flank region, fever, and hemoglobinuria, and may proceed to DIC. The third is febrile non-hemolytic reaction, which takes place within 1 to 6 hours of transfusing the blood. The white blood cells in the stored blood produce different cytokines, and these cytokines trigger the immune reaction in the recipient's blood, which leads to fever, headache, and chills. And the fourth one is urticaria, which occurs within 2 to 3 hours of transfusing the blood, and IgA plays main role in this reaction. And the fifth is trolley. In trolley, the donor's blood contains anti-leukocyte antibodies, and these antibodies attack the lung tissue of the recipient, leading to respiratory distress and pulmonary edema. The next is TACO, or transfusion associated circulatory overload. It occurs either when the rate of transfusion is too high, or the quantity of blood being transfused is too high, and the excess fluid backs up in the lung tissue, leading to pulmonary edema. Delayed hemolytic reaction takes days to weeks after transfusing the blood, and this occurs in response to minor antigens present on the surface of red blood cells. And the graft versus host disease, it occurs after weeks of transfusion. It is very rare but almost always fatal, and the immune cells in the donor's blood attacks this different body cells of the recipient, and the recipient is immunocompromised for this reaction, and it leads to pancytopenia, rashes, and different GI symptoms. Now let's discuss how some of these reactions can be prevented. The anaphylactic reactions can be prevented if we properly wash the blood, and washing the blood removes different proteins present in the blood, which provoke different transfusion reactions. And acute hemolytic reactions can be stopped if we properly check that the right blood is being transfused to the right patient to prevent ABO incompatibility. And the febrile non-hemolytic reactions can be prevented by leukoreduction, or reducing the number of white blood cells in the donor's blood. And trolley can also be prevented by washing out blood. If you found this video helpful, give it a thumbs up to support my channel. Thank you.